We are just going to go ahead and introduce what the heck this even is, why we're doing it, who we are, and why we're qualified to be talking to you about this right now. So, Roland, I'll let you take it away from outer space.
From outer space, hey guys. Obviously, you guys know myself, Alexa. You might not know Mel yet, but you guys are going to get to see her face every single night this week and for the ongoing future. And the reason why we started this group is just to give back to home service companies. We have a lot of knowledge ourselves that we've accumulated running a business as well. And we want to make sure that we can give all the information out to you guys, answer lots of questions, help provide you guys with any resources you might have, links, documents, a place to ask questions. If you need a second set of eyes, or you need somebody to tell you to calm down or to help your employees or whatever it might be. So we started this for you guys. And so this is the first time we're trying to do this on both Zoom and on live. So as we keep doing these every single day, we ask for feedback and suggestions from you guys so that way we can make it better and even more helpful for you guys. So don't feel afraid of giving us like criticism and feedback because we're doing this for you guys. We're staying extra late at work. We want to make sure we give you guys the most important information every single night. So that way you can watch something else other than maybe just the TV and kind of hearing the generic reruns and news that is specifically just for you guys. So given that, I'll let Alexa kind of introduce Mel and go to the next sets.
Yes. So kind of going off what Roland was saying, we created this group. It's a no judgment zone. Like there are no stupid questions. It's a completely real thing that's happening to all of us. And so this is a group that you can have that open discussion. There's no talks of politics, religion in here. It's solely about business. So we just wanted to put that out there and then kind of introducing what we're going to be doing every evening for the foreseeable future, Monday through Friday at 5 p.m. Pacific Standard Time. So East Coast, that's 8 p.m. And if you're anywhere in between, you could figure it out. We will be going live in this group in Zoom, and we're going to be talking about I'll break it down for you how the structure is going to work. Mel is going to be going over what's happening in the world right now, what's happened since the last time we all met here at 5 p.m. yesterday. And then we have a topic for the day. So today's topic, as you read, it's all the resources you need to know. And Mel's going to be going into that further to really help you understand what you're looking for on these sites, what information is important, what isn't, and how to relay that to your employees and how to comprehend that for your business. And then I see, like I said before, a lot of questions rolling in here. We're going to take that time at the end to answer some questions. So whether or not your question gets answered today, we will do our best to answer it in one of these lives or even post a resource on it. So that is what you guys are tuning into right now. I'd love to introduce Mel. So Mel is she's our Senior VP of People at Housecall Pro. She is the most qualified person to be talking to you guys about HR issues. And we are so lucky that she has volunteered her time to come on here with Roland and I and share with you guys all the knowledge she has, because as an employee of Housecall, it has been so helpful. I've been getting all of my coronavirus news and updates and reliable information from Mel. So I will let Mel introduce herself.
Thanks, Alexa. Thanks, you guys, for having me. I'm Melina Fairleigh. Most people call me Mel. Feel free to do the same. So first, just to get a few things out of the way, I'm not a doctor. I'm not a scientist. I'm not a lawyer. I'm a mom. I'm a homeowner. I have 4 kids, and I have 20 years in human resources. So I do head up the people team here at Housecall Pro, and I've been doing daily coronavirus updates with our leadership team for the past several weeks. So as this thing has been changing and evolving so quickly, that's really become valuable for us as an organization. And so we wanted to go ahead and offer that same opportunity to the home service professionals that we serve and elsewhere. This is an open group, so invite the folks that you know to join. You don't have to use Housecall Pro, and we're not going to make this into any sort of pitch. It's really just information that you need. So as point of background, 20 years in HR, I spent most of that in retail grocery. So I know a thing or two about working directly with the public. I led recruitment and development for one of the coolest grocery stores on the planet, Trader Joe's. And I helped them, grow lots of stores and open across the country. They're in 40 plus states at this point. So just before we get started, just a quick word of thanks to all of the grocery store employees out there, Trader Joe's and elsewhere. I know all of you have been in grocery stores in the last week or two. It is hard out there. And of course, also to the medical community, our nurses, our doctors, our home healthcare aides, our retirement workers, the real front line in this fight. And of course, my heart goes out to all the families, anyone who's been impacted by coronavirus in any way, from the smallest way until those who have been most deeply impacted. So just want to set that context a little bit. So really what we want to talk about today is where you can go for reliable information. The World Health Organization found that information from someone's employer is actually one of the most highly valued sources of truth, even more so than many government sources. Your employees are looking to you to have the answers and to have the right information. And I can see from all these questions that are coming in, it's hard to find the answers that you have. And that's to the questions that you have. And it's going to be okay to not have all the answers, but transparency with your employees and then transparency with your customers is really going to keep you down the path of being able to navigate through these very quickly changing times. So I'm going to tell you the resources that I've been using to make sure that I have the right trusted information in order to update my team every day. And you can hopefully start to do the same. Of course, I'll digest this information for you daily and give you updates as well. So if you prefer to just tune in at 5 o'clock every night and hear what we've got to say, you can use that information to update your employees.
Yeah, we'll also be providing the recordings for everybody after this. So if you happen to miss it, or you've got something else going on, or kids driving you nuts, whatever it is, we'll provide the recordings for you guys on the website. And then also, we're going to be putting together a PDF that's going to contain all the links and things that Mel's sharing here tonight. So that way, if you wanted to either pass that around to other fellow pros, send that out internally to your team, whatever you want to do, we'll be providing both those resources to you guys after this. Just give us a little bit of time to compile it, and we'll have it for you guys as quickly as we can.
Yep. It will also be available on the landing page for this, housecallpro.com/coronavirus. And Natalie has uploaded all that stuff for you there. Our goal is to just keep you in the loop, keep you informed with everything we know, because we are in a really cool and unique position to have access to all of this information, and we have the resources to digest it for you and figure out what it means for you as a business owner. So without further ado, I'll let Mel take it away. She's just going to run you through the resources she's been sharing with us, and yeah, tune in.
Great. So first I'll give you an update, sort of the state of the world with coronavirus these days. And then each day I'll tell you what's happened since the previous day. So this update will be a little bit more thorough than we might have going forward. But as of this morning, Johns Hopkins reported that there were over 169,000 cases and over 6,500 deaths worldwide. So we're really starting to see quite an acceleration, which includes 3,800 cases in the US, and it was 69 deaths as of this morning. So quite the staggering numbers. The largest outbreaks, as you probably know and have heard, have been in Washington State, New York, and here in California as a state. So we're seeing the situation change really quickly. Classes have been canceled in a majority of states. I'm sure we could have you guys start commenting how many of you have kids out of school. I've got 4 kids out of school, 6th, 7th, 8th, and 9th grade. They're bored already. Several US states and territories have implemented curfews and other restrictions, everything from shelter in place up to, potential closures and mandatory closures of bars and restaurants, takeout only in some places. All the non-essential stores asking them to close. So I know we just had news out of Pennsylvania. I've seen several of you asking questions about that. So we'll talk about where you might be able to get some answers to those things. The San Francisco Bay, where we do have some employees, they've been directed to shelter in place through April 7th in an attempt to contain the virus. So you've probably heard the calls for social distancing. So that term is one that I think I've never ever heard before, but now I say it about 50 times a day. So social distancing is the new call to action. So this is canceling events with crowds, deliberately increasing the physical space between people. So Alexa and Roland are in San Diego, and so am I, but we are not together. So I am coming to you from our pretty much empty office, and they are each in their respective homes. And that's part of social distancing, increasing the physical space between people. So what we know is that staying at least 6 feet away from other people lessens your chances of catching coronavirus. And we know that as cases continue to grow across the country, there are a number of concerns, primarily around our ability to handle unexpected surges. So the social distancing is meant to really just slow, or what you might have heard is flattening the curve, to slow the increases in cases in ways that our social services and medical services can't handle. So that's really what you're seeing as the US response. We're getting fairly detailed updates out of the White House, and all of our news outlets are certainly giving us updates on what's going on. In San Diego, just within the last 2 hours, we heard here that bars are closing and restaurants are going to take out only. So it's changing very, very quickly. So because it's changing so quickly, you might need some information outside of just 5 o'clock Pacific every night. So it's really important that you get tuned into the most relevant and up-to-date information. So I just wanted to share with you, and this is what will go out to all of you as a resource, the links and sources that I've been using on a daily basis to get reliable information. So the World Health Organization is certainly one that will show you the global picture. And then in the US, the Centers for Disease Control and Prevention, what you hear is the CDC, they have an entire dedicated portion of their site dedicated to coronavirus. Everything from flyers that you can print out and post in your workplace. You can post them at home for your kids to know how to wash their hands. They've got resources and recommendations for what to do if you're sick, what to do if you think you've been in contact with someone who might be affected by coronavirus. So the Centers for Disease Control is a site that I start every morning just by visiting to see if there are any new updates. And then especially important in the trades, as you guys are probably familiar with OSHA, the Occupational Safety and Health Administration. They've actually prepared a guidance, a flyer on preparing workplaces for coronavirus. It's called their Guidance on Preparing Workplaces for COVID-19. And it shows what you should be doing in different levels of risk as far as by occupation. So many of you would be in a more medium or higher risk occupation, meaning direct contact with the public, versus me who's in an office. But even for an office worker, it would have those recommendations. And then I mentioned at the beginning that I've been getting updated numbers from Johns Hopkins. They've been aggregating or pulling together all the different sources of reports across the world, and they've turned it into an interactive map and also a daily update. So I've subscribed to the daily update. It's written in sort of scientific language half the time, but it's got the full story, all the numbers and everything that's going on in the world with coronavirus.
What about county levels, yeah. Mel? What about county levels or state levels?
Yeah, so the most important thing, so those are the big, the CDC, the World Health Organization, OSHA, Johns Hopkins, but what's gonna be closest to home for you guys and really hope to answer some of the questions that I've seen coming in are two resources that I want you to start to look for. One is your local county level, health services, your Office of Environmental Health or Health and Human Services. They're called slightly different things in different places. And then also your state unemployment office. There are lots of people asking questions about, what happens if I don't have a full 40 hours of work for my employees? What should I do? What should they do? So state by state is where you're going to find the information on if people, can apply for unemployment benefits if they've had a reduction in hours, which they typically can. So you'll want to become real familiar with that. I was just on California's unemployment office's site today, the EDD, and they had updated all of their information to include very coronavirus specific scenarios and questions. So I think we can expect to see other states do the same thing, try to make their landing pages more friendly for the people that are coming with these very similar questions. So those are the main sources, and it looks like we're posting those up for you guys to see. And I know we have the actual links available that will
that's what I was going to say. So the thing about the county level health notifications was something that was new to me and now something that I've been checking. And we actually found the website where you can go and put in your county and your state, and it will give you the contact information. It will give you the link. So we've already gotten that for you, and we're going to be posting it here. All you have to do is go in and put in your county to get all that, the unemployment office information. And what was the other one, Mel? The county health one.
Yeah, county health or environmental health, health and human services, they're all called something a little bit different. And then some of them have, and I'll just show you here, like I'm getting alerts from the county of San Francisco. I signed up for text alerts, and today I received text alerts telling me about their shelter in place order that goes into effect at midnight tonight. So I have a few employees up there, so I want to stay tuned into what's going on so that I'm not hearing it secondhand. So not all cities or states and counties have that type of service, but go ahead and get connected with your local resources.
So that wraps up kind of the chunk, the meat of this evening update. Every day, as Mel said, she'll be going through and giving you the most recent updates like she did today. So if you don't want to be reading these yourself, Mel will absolutely be that sounding board for you. Before we sign off, there's been a bunch of questions that have flooded through, and unfortunately we won't be able to answer all of them today, but we do want to answer some that stay within the topic that we're on today. So I'm going to go through here, Roland, if you see any, or Mel, if there's any ones at the top of your head
So Cassie Pound asked a great question, which is, are we liable if we keep employees working and if we send them into customers' homes?
Well, there's different information out on whether it could be a workers' compensation case if someone were to contract it at work, and then usually that's indicated by how much it was truly caused by work. The more it is hard to determine, the less likely that you would be able to say that it was caused by the workplace. Like me in an office environment, if I became ill, it'd be pretty unlikely that I'd be able to show that it was because of my workplace. But certainly if we are required under OSHA to provide a safe workplace for our employees, so if we don't feel confident that we can do that, then that would be indication that we should be making other arrangements, figuring out how to approach business in a different way, or really just get with our employees to get their suggestions in addition to those that have been provided by OSHA and the CDC, to figure out what's their exact concern if they are concerned.
Yep.
So I see another one here from our Zoom meeting. Who's this from? ERI, I can't see it. My biggest question at this point, should I be doing routine maintenance or should I only be doing emergency service calls? I'm in the heating and air business.
So I think I saw that question earlier was from Pennsylvania, where just within the last few hours, they've indicated that all non-essential businesses should close. So non-essential is going to be potentially defined in different ways. I mean, until you get specific guidance from your county or state, which I would imagine they are all scrambling to provide as well. This is so incredibly fast moving that nobody has a playbook. So until that happens, you should be using your very best judgment to interpret the new regulation or order as you understand it. It's really about good faith, right? So if you deem something to be essential and you're waiting for that confirmation, that's not your ideal place to be in, but you'll be continuing to reach out to your county to ask for additional specific instruction. We're starting to see some things come through, but I have yet to see a definitive and super detailed list. I know one question on the Facebook group would be like, hey, is garage door essential? And one of the good responses was, well, if the garage door is stuck down and you've got a medical worker that needs to get, out to work, that probably is an essential service. And that's like, okay, that's an interesting way to think about it. There's not an exact playbook for that question. And I wish I could give you a definitive answer. And certainly we'll continue to research as this keeps moving.
Yeah, a good way to think about it too, just from like a moral barometer is, if it was your family, would you go visit them? So if it was your grandma, for example, would you be willing to expose them, go in there and provide the services? Is it really essential to them or is it not? And use that kind of as the kind of the moral compass to help lead you down the right path to the answer that's right for your business.
Yeah, I mean, at a minimum, you should not be allowing any employee to come to work ill in any way, shape, or form. And sometimes folks will say, I'm feeling fine, it's just a sniffle. But it's really our obligation to, during times of a pandemic, which is really what they've now categorized this as, is to get more directive. Whereas before it'd be like, hey, if I'm feeling 70%, I might come into work. Now it's, you need to be feeling 100% and be completely symptom free for at least 24 hours, even if you just had a cold. If it's anything that seems like flu-like symptoms, those employees need to be encouraged and asked to stay home.
Mm-hmm. Kind of going on that same note, there's another really good question. Should we be having our employees sign documentation stating that they are willingly wanting to continue work?
Well, I think showing up for work is willingly wanting to continue work. So would you have them sign it every day, every hour? I would say that, you know, if workers are choosing to continue working, then that's their indication that they're on board with it. But we are required to provide a safe work environment again. So if you're getting indications from your workers that they're nervous in any way, that's probably a signal to you, right? So the front line is the one who really is the one interacting with your customer, interacting with the environment out there. So get really close to them, meaning communicating with them, phone, what have you, to ask them, hey, how they're feeling and what's going on. You might be getting a signal there of something that you need to look at.
Mm-hmm.
Good advice. So we got a couple more here. What should we do when entering people's homes as a service contractor?
Yeah, so I mean, certainly I'm no expert in how you do your individual services. There are many different types of services that all of our folks are providing, but certainly it's that all the recommendations that OSHA provides, there are different personal protective devices and things that need to be used based on the type of service that's being provided. And then again, state by state, there could be indications that there are some services that might not be deemed essential that are being asked to be paused at the moment by different governments. So I think this group probably could come up with the best list ever, everything from, you know, gloves to booties to masks, to washing, to soap and water, to hand sanitizer, you know, all of the different, you know, sanitation precautions that people have been taking. But certainly any surface that's touched is just a good idea for all of us these days to be using one of the approved disinfectants to be able to mitigate or lessen any potential you know, infection through surfaces.
Mm-hmm.
Yeah, and I think another best practice is always over communicate. So make sure you're asking the customers even before you enter, is there anyone sick? Has there anyone in the household that's been traveling? So just as much as you're looking to protect them, also make sure you're protecting yourself and asking the right questions that you need to do to kind of get to the right decision there.
Mm-hmm.
And
I actually
that
think
6 feet is really important, right? I mean, these are home services. So these are services that you can provide without a person within close proximity to you, and out of respect for the individual, the homeowner, and respect for yourself or your crew. I mean, those should definitely be places that we include social distancing into. Just the new normal is to social distance when providing a home service.
I think there was a pro who posted in this page an actual list of things that they're asking their customers when booking a service call. So look on this Facebook page. There was someone on here who posted, like, is anyone in your home over 70? Has anyone been out of the country? All the basic questions. So feel free to go comment on those if you have any other ones. I'm sure that person is willing to share. That's why they posted it in this group. And I think
we'll go pull it too. We'll go pull it too and put it in our resources, just so you guys have a little cheat sheet.
So I think we have time for one more question. And if we don't get to your questions today, please know that we are cataloging it. We have a whole document going where we're copying and pasting all of your questions, all of your posts and comments, so we can answer them in future evening updates. Let's go ahead and answer one more here. I liked it. So this is Jason Mays. I have never had to lay anyone off ever, but I might need to. In case I go that route, will it impact my unemployment insurance rate? Do we know anything about that?
Unemployment insurance rates are the rates that you pay through your payroll taxes based on your employment record as an employer. There is a percentage that you pay, and that percentage can go up or down based on your record. I can't imagine that our lawmakers aren't already thinking about this time being a bit of an asterisk in time. Certainly I would be. So hopefully that's not something that we all have to worry about as employers. But in general, so what that's meant is that, let's say you're an employer and you have a habit of hiring up more people than you need and laying off, hiring and laying off, hiring and laying off. That's not being a responsible business person. And so that person would pay a higher tax, unemployment insurance tax through payroll taxes to offset the cost to the state. And this, I'm speaking from a seat in California, but I imagine other states are pretty darn similar. That would offset the cost of providing all those unemployment insurance services to those who have been laid off. One thing to keep in mind, however, is that you may find it more beneficial to reduce your employees to part-time or even take them off the schedule, but not lay them off. They could, in that case, still apply for unemployment benefits. For example, in California, if your employees reduced your hours or shut down, they can file unemployment insurance claims, and it provides wage replacement for that difference between what they've been earning and then what they're earning now. It doesn't provide 100% of the difference, but it uses that, that amount to determine their eligibility. And in this case, workers who are temporarily unemployed due to the coronavirus, but are expected to return to work with their employer once we get to the other side of this, they're not required to actively seek work each week elsewhere, which is typically a requirement of unemployment, is that every week you have to show that you're looking for a job. So in the case of, hey, look, I used to have 40 hours a week for you, I've got 10 hours a week for you. It may be better for you and the employee to reduce their hours to 10 hours as opposed to laying them off. You can ramp them back up when things are back to normal again and they're available and ready to work the moment that this thing shifts. So keeping your employments on part-time may help you wrap up more quickly when the need arises. But most importantly there is, as I mentioned at the beginning, to familiarize yourself with your state's unemployment department website. Many states make it fairly easy for people to apply online. Some states have a 1-week waiting period before benefits kick in. Some are starting to waive those waiting periods to have benefits kick in right away. So go ahead and take a look at your individual state to better understand what the benefits are so that you can better make decisions for your employees.
Mm-hmm. Wow. So I feel like we were able to cover a lot in just this 30-minute.
Yeah, 30 minutes flew by so quick.
30 minutes. So I know a lot of you guys have put questions in here. Like I said before, we're cataloging all of them. We will answer them, whether Mel answers them live or we're able to get some type of content or resource out about them. But I guess we'll just close it up now by asking you to, if this was valuable to you, we really want to know. So let us know if this was, comment on it. What would mean even more is if you got this word out to more pros, share it so we can all be equal in knowledge and we can all lift each other up during this time. So Roland, do you have anything? Mel, anything else?
No, thank you. I don't purport to be an expert in all things coronavirus, but I promise every day to take a look at all the news that's out there and try to put it together in a way that makes it digestible at the end of the day so that you can be out there thinking about other things. So that's the goal, and we'll get better at it every day. So thanks for joining us tonight.
Yep. Remember, we'll be providing this recording. It'll be at housecallpro.com/coronavirus once it's fully uploaded to the cloud. So if you guys want to rewatch any part of it, or you wanted to slow it down because we covered a ton today, you can always rewatch it. We'll also be providing the resources that we discussed here with all the links to everything that Mel said. And we'll also be sending out a PDF. So you can always find all this stuff at housecallpro.com/coronavirus. And it'd mean the world to us if you guys could take our group and share it with some friends, because this is for all home services. In reality, it's really for anybody. So we'll be doing this 5 p.m. every single day here. We'll try to keep it 30 minutes punctual. And let us know if you guys have any feedback, suggestions, and we'll see you guys tomorrow.